Hi, I'm Krissy Bielewicz with the Journal of Allergy and Clinical Immunology, and I'm here with Dr. Marc Rothenberg of Cincinnati Children's Hospital, and we're talking about a disease called eosinophilic esophagitis. And in a recent publication in the journal, Dr. Rothenberg and his colleagues quantified twin and family studies of heritability of the disease. Can you talk a little bit more about that, Dr. Rothenberg?
Sure. Thanks, Krissy, for this opportunity to speak to the readership and other people interested in this field of eosinophilic esophagitis and allergy. When you use the word colleagues, I want to say that I put that in quotes because this study involved people from all over the world, and doctors contributed to this and patients from around the globe. Because what we did in this study is we called for a registry of twins with eosinophilic esophagitis. We called for the registry, we posted this on various websites, we sent out newsletters and requests, and lo and behold, we found 60 some odd twin pairs with eosinophilic esophagitis. Well, what did we learn from this study? First, we compared these twins to regular siblings that we have here at Cincinnati Children's, a cohort of about 800 different families where we had family histories and different siblings. And we were interested in figuring out is the difference between genetics and environment. Twins allows us to assess the role of genetics because identical twins share 100% of their DNA. Dizygotic twins or fraternal twins share 50% of their DNA, which is exactly the same as regular siblings share. And what we found was an amazing finding. First, I'll say we did find that the twins have more co-association of eosinophilic esophagitis. So there was a higher rate of concordance between the two siblings. So in other words, if you have identical twin, we found that 40% of the time there was concordance in the other twin that had the disease. Now that's an amazing finding. It does indicate a role for genetics, but it does open the question, what about the other 60% of the people that have exactly the same DNA? They do not have the eosinophilic esophagitis. And that says that the environment is also playing a major role. What we also found was that the dizygotic twins had surprising high concordance between themselves. It was nearly the same as the monozygotic or the identical twins. It was less, which you'd expect, but it was tenfold higher than a regular sibling. So what that means is that if you're a twin and not identical, you do, however, have a tenfold increased risk compared to regular siblings. And that says a lot about the etiology or the cause of this disease, because the only thing different genetically about a dizygotic or fraternal twin than a regular sibling, is the environment in which the baby and the child has been nurtured, primarily in utero and then in an immediate postnatal or perinatal period. And that tells us that the environment, particularly in early life, is very important for shaping the risk susceptibility for this disease. So indeed, we've shown in this paper that genetics is important, but we've also defined a dominant role for the environment, and we believe that it's an early life exposure that leads to this susceptibility.
Dr. Rothenberg, what do you think is the most important message you'd like to highlight about this paper to the readers?
The most important message, especially if you're a clinician, is that if a patient asks you, I have one child with eosinophilic esophagitis, what is the risk for the next child? You can tell them that research has shown, published in the #1 allergy journal, that the risk for another sibling is only about 2.5%. So 97.5% of the time, the child will not have another sibling with eosinophilic esophagitis. If they do have a twin, the story is different, and the risk will then go up to closer to 30, 40 to 40% of the twin pairs.
Thank you, Dr. Rothenberg.
Quite welcome.
If you like this video and you'd like to see more, please visit our YouTube channel. Thank you.